Good evening. The news gang is here. It's open season for COVID-19, or is it? We have the open questions around the rising numbers, the hard lessons of 2020, a lost year, and teachers' private pain. Also on the show tonight, handshakes and fisticuffs, the committee stage of the Uhuru Raila project. And is the DP wandering in the wilderness, or is he on the edge of the promised land, a land full of salon equipment, car washes, animal feeds, and every other hustle? On the take, Yvonne has an apology to make for imagining a new Kenya. Gashuri is puzzled that policemen are still punching people 30 years after Sabasaba. Those police kicks also graced the kicker, Sabasaba in 1990 and BBI in 2020. Kai asks, are we any nearer to the reform destination? The angle is a cry for our beloved exam candidates, while the memo tonight is Jamila Mohammed is away for a short break.
Today, we have recorded the largest number of positive cases since we first started reporting. 447 people have tested positive.
All right, ladies and gentlemen, let's get the show started. 447 people, all in a period of 24 hours, Linas, just a few days after we reopened, and just another high in a series of record highs that we've been talking about quite a bit the last couple of weeks, actually.
Yes, Joe, there's no doubt that the numbers are getting worse. And what is also happening is we are improving on testing. I think more people are getting tested than before. But what will also happen is these numbers will be looked at against the backdrop of the measures taken early this week by President Uhuru Kenyatta and the government opening up the country, basically. And the worry now should be on also the state of affairs in the countryside, which had not reported as many cases as, say, Nairobi. But now the open season, like you said at the beginning of the show, Joe, means movement is free, means these people can reach the countryside, means the virus can potentially reach areas that had either to not had the infections.
Wow. Yvonne, what are we to make of these numbers? We were told that when we approach the peak, we'll be seeing all of these things. Do you get the sense that we all behave like we are actually in that zone?
No, we do not. I think we heard from, was it Dr. Amoth, who said once we hit our peak somewhere in August, September, that we may start to hear reports on a daily basis of between 400 and 500 cases. Alas, here we are on a day like today when we've had 447 cases. And those are the samples that were taken out of, what, 3,803 samples? Yep. And I believe this was the highest percentage of positive cases over samples tested. I think this is at about 11%. Yet in the country, perhaps many people confusing the easing of restrictions with
lowering of their guard.
With lowering their guard, and with, so to say that, you know, everything is okay, so you can go back to work, go back to the rural areas. You know, I think this is very interesting. These numbers are coming at a very interesting time. I mean, if you take a look at 8,975 is the total we're at today. I mean, like every day when we read the stories, we say, oh, we're hitting the 5,000 mark, past that, hitting the 6,000 mark, past that. It is certain that we would be at 10,000 over the next 2-3 days, if this is anything to go by. And my worry is just how you continue to see crowds around public transport areas, how people are excited to go back home. But you also understand the dilemma they're in, because now that the country has been reopened, there's many people. In fact, we just did a story tonight about 39% of Kenyans who are unable to pay their rent for the month of May. That means they're already in default. And so many of them are finding it easier to go back to the rural area where you're not paying rent, you're probably growing a little bit of your foods and not having to stick with those expenses. So it's going to be interesting. Without a doubt, everywhere that we have seen this, there is going to be a surge and a bigger one as the days come now that we've opened up the country.
Actually, someone was saying that some of the people who are in rent arrears might actually look at the things in their house and just try and evaluate whether they are worth the amount of rent they owe, or whether they can just walk out and,
just leave it all behind.
Leave them there. But let's listen to what CS Mutahi Kagwe said about where the responsibility is now shifting to, before I come to you, Francis.
With the relaxation of some of the restrictions, the responsibility shifts to us. I can only plead that kwa sasa jameni, tujikinge na tukimbie sana kutoka kwa hii virusi. Na hiyo kukimbia kwake ni kufanya vile sisi tumesema.
You see, before all of these things, there were policemen at the roadblocks. People, of course, tried to sneak in and find all these Panya routes, but they were there and they could stop you from going if you actually approached that roadblock. There were policemen in different places trying to make sure that this, in Mombasa, in Mandera here, the government was here telling us every day what we needed to do. You can't go to the village, your old Shosho is there, you're probably going to kill her. But now, it says, hey, sasa kazi ni kwako, tukimbie sana kutokana na hii virusi. And yet you look around, it just looks like right now there's no problem in this country.
When I listen to the health CS say responsibility now turns to us collectively and individually, easier said than done. Even when the government was still monitoring, pursuing, coercing, intimidating, persuading people to take care, it was still an uphill task. Now that the government is telling us, deal with it, you're on your own, it's easier said than done. I mean, we've all been around and we've seen how people are behaving. It doesn't give you any impression that many people are taking this situation very seriously. And you saw yesterday the rush up country, and it was inevitable that people will go up country. Why? Because many people have lost their job opportunities in Nairobi, another major town. So they have opted for safety in their rural areas. And you can now imagine what is happening in many rural areas. People are not necessarily wearing masks. And there's also this impression that you're wearing a mask to avoid arrest. I've had people call them chin guards. Yeah,
necklaces.
And other people calling them necklaces. So it requires a lot of civic education why people have to do A, B, C, D, as opposed to doing it to avoid arrest, doing it to avoid falling afoul of the laws and so on and so forth. But also, my bigger concern is as people go up country, as we are told to take care of our own, the preparedness in our counties. In the county hospitals. It's terrible. A friend of mine is telling me that he's very impressed that Yvonne has told us what constitutes an ICU. Because what I've seen governors do is showcase a few beds here and there and tell us this is an ICU. And we are prepared. Some even telling us of hundreds of beds that they have. There are even stories of how some governors have taken beds from private places, paraded them for the CS to see how prepared they are. Now the reality is dawning because those preparations that you're making, the people you are supposed to make preparations for are now coming home.
Yeah.
So now deal with it. And in the event there is a likely surge in infections up country, we will now see the reality of COVID-19 in our country. And it will be impossible to tell guys to come to Nairobi because even Nairobi has its own problems.
Right.
When you hear that facilities are overwhelmed, I saw a video.
Mutahi said today that the counties will no longer be sending cases to Nairobi.
Precisely.
You deal with your own cases at the county level.
Yes, this now clearly will expose our inadequacy, our failure to invest fully in the health sector across the country for these 50 plus years.
And Yvonne, something that struck me. I mean, there are so many things in that ICU place that you visited. I mean, by the time you're talking about, I don't know, cardiac defibrillators and things like that, I mean, you get the sense that there are a lot of places in this country, a lot of health facilities where people actually have never seen any of those things, because it wasn't just about the equipment, it was also about the people who operate the equipment, that you actually have to train these people give them extra training for them to actually know how to function inside the ICU.
And I think one of our failures when we look at how to fix our healthcare system in general, not just in COVID, is we think of structures, we think of buildings. You know, even when we talk about the war against cancer, we say build a cancer hospital. But rarely do we ever think the totality of the healthcare system. So you have the equipment, which is important, the buildings, which are important, but the personnel as well. I mean, up to 7 personnel are required for an ICU unit. Do we have enough of these? By the way, a lot of that specialized ICU training, most of it is done outside the country. Wow. So you're talking of 12 years to get one person fully trained to work in an ICU unit. Let me just give you an example of perhaps an illustration with the nurses. Now, the standard ratio of nurses to patients in the ICU is 1-to-1. One nurse to one ICU patient. So that one nurse can't look after 3 patients during their shift. It's 1-to-1. And usually they have to have they have 3 nurses for a 24-hour shift. So if you take a look at that, that's 3 nurses for 1 patient in a 24-hour shift. And what the doctors at the KU hospital were telling me is that they have seen for COVID patients in ICU, they take about 8 to 10 days in ICU. Wow. Now, luckily at KU, the charges of being in ICU per day are taken up by the government. But someone still has to pick up the tab, and that is the taxpayer. So if you're thinking 30 to 50,000 per day for these students, for these patients, and that's over an average 8 to 10 day period, you can look at just the cost of maintaining a patient in the ICU for just, 1 day. And the costs are astronomical. So something to think about. One other thing I just want to talk about, even as they're shifting responsibility to us now that they've reopened, we do need to hear a more comprehensive report from the Ministry of Health as to what they did with the 3 to 4 months of restricted movement that we had, because the idea was that they were to restrict us from moving so that they can prepare themselves, the counties with the beds, the ICUs, the doctors. So I would like to see item by item. When we got this money from the World Bank to hire workers, this is what we've done with it. This is how many workers we've hired. This is how many hospitals. Like a very detailed report of that. Even though the president said we've reached a reasonable level, we didn't quite hit his irreducible minimums to reopen. But what have they been doing over the last few months that they have restricted movement for them to now tell us you're on your own? And
there's a big debate going on already whether the lockdowns really helped that much. Like how much worse would it have been if the lockdowns, especially of Nairobi and all of this, would have been. But Linus, I don't know if you have anything to say, because I wanted us to go to the education bit as we prepare for that. Yeah, you can.
I will just emphasize the point that has been raised by Yvonne about accountability, because it ought to be two-way. You can't address the nation every time and say, you guys are getting it wrong all the time. The government is in charge of restrictions. And when you say curfew from 9 p.m. to 4 a.m., and when you say no movement into or out of Nairobi, no movement into Eastleigh or out of Eastleigh, no movement into or out of Mombasa, there must be some form of accountability. And also that ought to be public as well, where the government says, this is what the measures produced. And I think we've said this a couple of times on the show, because accountability ought to be two-way. We shouldn't have a situation where we think that the health authorities are getting it right, but the public is not. It doesn't work that way. If you look at the numbers in Rwanda and the numbers in Uganda, you can tell that they are getting somewhere with their restrictions. The curve is actually declining in terms of the numbers. At some point, Uganda on the 20th of June had 0 infections. Now, we wouldn't know whether it's 0 because of not testing, but a day with a zero is a major, major success when it comes to this COVID-19
Oh, and LK,
situation.
they've not had a single death, huh?
They haven't had a single death as well.
Yeah.
So we need some form of accountability. The government ought to explain what did the restrictions produce.
And actually, there's now growing evidence that those restrictions partly disrupted management of other diseases. For example, the non-communicable diseases, hypertension, diabetes, cancer, all of these things. That one, the disruption, the lockdowns that have happened globally, but also within countries. Then there were also, for example, healthcare workers that have been reassigned to deal with COVID-19, so that you find screening, for example, for breast cancer. The WHO released a report the other day that was saying that in more than half the countries around the world, they found that screening for breast cancer, for example, had been disrupted, had been postponed by several months, because the people who would be doing these kinds of things were actually now redeployed to the COVID-19 response. And whereas COVID-19 is a serious, highly infectious condition.
Cancer can't wait.
It can't wait. And cancer, by the way, kills, I think, more than 2,000 times more people than what we have lost from COVID-19 so far. So not to minimize the seriousness of this, but to also say that at the end of the day, we'll be looking back and saying, what was the cost of doing some of these things that we did, and was it all necessary? There were certain things, for example, closure of schools and all of these things that one might say, well, even now probably we're not ready. But there are also things that you might want to question later on and say, did we do the right thing? And I think that debate is going to come in not a too distant future.
That's right.
My other, as we go to the break, my other concern is the application of the guidelines, because there seems to be double standards. There seems to be, especially from our political players, there seems to be, these ones can do, these ones can't. You've seen a bit of tear gassing here and there, but at the same time, when you see other meetings being held and there's no tear gassing, it gives the impression that there probably is, a mismatch in the application of these guidelines. So there's probably a need for that uniformity, because truth be told, Corona doesn't bother whether you're a politician or not. I mean, we've seen even parliamentarians testing positive for it. So there is also. We know.
True.
So let's hope that there will be that observance of the guidelines by all. Otherwise, it's going to create an impression among ordinary citizens, like if so and so can meet and no one is asking them questions, then
it's never that serious,
never
perhaps.
that serious.
Yeah.
Okay, let's take a break. When we come back, we'll actually talk about the lost academic year.